Privilege and pleasure to welcome you to this global table that focuses on the social and economic implications of the COVID-19 pandemic and looks beyond, recognizing that in the future we will in fact be subjected to similar or even greater shocks with the implications that we're witnessing becoming deeper and perhaps even greater. Today, I also should mention that we are on this panel are looking at these issues, particularly from the perspective of the Global South. We are using this as a mechanism for sharing the thinking and the experience and perspectives of the Global South within the G20 community. Since we are part of the Think 20, these discussions are used to inform some of the recommendations and policy recommendations that are made by the T20 for the governments and member countries of the group of 20 nations. My name is Margot Thomas, and as your moderator today, I'm going to introduce myself. I have spent most of my career in the World Bank Group, where I provided policy advice to governments on the national and subnational level on issues related to private sector development, inclusive growth, and generally investment, private investment, and the role of the private sector as an engine for economic growth. Towards the end of my career, I was appointed by the UN Secretary General to lead this lead the Secretariat supporting his high-level panel on women's economic empowerment. And as part of the answer to the call to action from that panel, I established the Women's Economic Imperative, and we've been focusing on women's economic empowerment, particularly in the area of entrepreneurship and advocacy. On our distinguished panel today, we have Rima Nanavati, who's based in India. She has had extensive experience in working with informal workers as one of the leaders of the Self-Employed Women's Association, working particularly in Southeast Asia and even in Afghanistan for the past 35 years on these issues. We also have the Honorable Charity Njilu, who is currently the governor of Kitui in Kenya. She's had a distinguished civil service career of service in government, where she served in the Ministry of Health, served as the Minister of Water and Irrigation, and the Cabinet Secretary for Land, Housing, and Urban Development. We also have Professor Alex Eze, who is currently a professor in the Dornsife School of Public Health at Drexel University. He was also the founder of the African Population Research Council and was based in Kenya during that period. We have Professor Fernando Filgueira, who's a professor of social science at the Universidad de la República in Uruguay, and has an extensive and active career advising governments in Latin America on issues related to social cohesion, equity in general, and gender empowerment. So with that today, I'm going to go directly into the questions to our panel. And I'm going to start with my first question to Fernando. Fernando, I would like, given the work that you're doing in sub-Saharan Africa, where your recent publication on the impact of COVID-19 on vulnerable populations in Latin America has pointed out that one of the impacts of this crisis has been the exacerbation of inequities and vulnerabilities affecting these populations. Can you help us to understand what are some of the key underlying issues and why is there a need for us to focus on social protection, the social safety net, and whether or not this net exists or whether it is very porous? Can you give us the key elements in this regard?
Thanks, Margot, and thanks to everybody. Yes, in Latin America, we confront or we enter into this particular phase of the pandemic as it starts to become exponential with three basic characteristics that have accompanied Latin American countries for most of its history. High levels of inequality, a situation of fiscal stress, of limited state capacity to deploy resources, and finally, and very importantly, a lack or weakness of public and merit goods. These three characteristics that have been with us for a long time become very evident as we move into the epidemiological attempt to contain the pandemic through processes of lockdown, confinement, and social distance. The major kind of economic and social disruption that this creates along the region poses a trilemma or a trilemma, one in which we are unable to pursue three goals that are critical at the same time. On the one hand, have an efficient and maximize our epidemiological response. Secondly, minimize social costs. And thirdly, sustain levels of adequate governability and political stability. We cannot do these three things at the same time unless we move into the creation of an emergency social protection fund. Latin America is quite varied, but overall, it has some of the elements of the welfare state that we can see in Europe, but fragmented, unequal, and incomplete. Therefore, through the non-conditional transfers and through other forms of cash transfers and food support, we need to reach the population that we are asking to stay within their households, with the major economic disruptions that it implies, with at least three things. One, public utilities, which do not reach all the population, but where they reach, they should not be suppressed because of absence of payment. Secondly, a basic set of cash transfers that will reach not just formal workers, but especially informal workers and households led by women, which are the most vulnerable in this situation. And thirdly, food programs where cash transfers do not work so that the basic necessities are guaranteed. And this is for the short term. But we need also to think, and let me close with this, that this is going to have major impacts, not just in the next 3 or 6 months, but for a year and a half, 2 years. And as you mentioned, Margot, maybe tomorrow, other kind of shocks will come about. So it's a good time to think about these three characteristics that have been central to Latin America: inequality, lack of public and merit goods, and fiscal stress, and how we can move beyond that to build an architecture that's both more resilient and more humane.
Thank you very much, Fernando. I'd like to turn to Professor Eze at this stage. As a demographer and a public health expert, can you help us to understand some of the key factors that countries and communities, particularly in sub-Saharan Africa, we've heard from Latin America, help us to understand the factors that countries and communities need to take into account in designing and implementing policy responses to the COVID-19 pandemic. And I also would like for you to take into account the fact that we have to see health as inimical to economic viability. So we also have to think about the health of these populations.
Okay, thank you, Margot. It's really a pleasure to be on this panel. If you look at the global response to the pandemic at this point, there's been very clear strategies that many countries have adopted. Africa has also adopted a lot of those strategies. Stay in place, social distancing, hand washing with soap, and also having to take those who are very sick and get them treated in hospitals. If you look at those responses and you look at, say, an urban center in Africa, what are the basic features of these cities? One is that there's quite a large proportion of the population that live in slums, informal settlements. What's the economy in Africa? Majority of the people work in the informal sector. And so if you take somebody who is living in a high density urban settlement, who work on a daily job, and you keep them in place for weeks or months, how do they respond to those realities? So the lack of adaptation of these global responses within our countries is a major gap currently. As of yesterday, we have recorded about 52,000 cases in Africa and about 2,000 deaths. And about half of these and 2/3 of the deaths are just in 4 countries, South Africa, Egypt, Morocco, and Algeria. How is it that we have achieved this level of, I think currently there is a major gap in our understanding of the disease epidemiology across the continent. For one, we don't know whether these low cases is just due to the demography of Africa, where we have a very young population who may be more resistant to the epidemic and therefore not getting very sick and not coming to the hospitals. But we also do not know if people who are quarantined at home are dying and not being captured and recorded. We don't know how the spread is across the various countries on the region. So what we need urgently is a seroprevalence study that looks at antibodies across a larger population to know whether the quarantine in place has worked for Africa or whether it has been a painful experience with less than the anticipated benefits that we could generate from it, if indeed there has been very widespread but limited impact on people as due to the population structure. But in the midst of this pandemic, I think there are a number of things that have been very clear. One is that countries have tended to respond to it independently in many ways. We started off with closing borders across the world, even in Europe that has free borders. Many of those borders became closed for the first time in decades. And within that period, I think for many of the African leaders and business leaders and political leaders, we have seen that we cannot just get off and go anywhere in the world to get treatment. And we have had to depend on our local institutions. Unfortunately, the many years of underfunding and neglect of these institutions has created serious gaps in their ability to respond to this pandemic. And I think this is a lesson that we will have to learn through this as we go through. Currently, there are over 1,700 clinical trials going on around the world. Only 28 of them are happening in Africa and 19 of them in Egypt. Only 7 in the whole of sub-Saharan Africa and largely Nigeria and South Africa. Of those 7, 5 of them are testing hydroxychloroquine, which has been discarded now as ineffective therapeutics for the disease. So, and only 2 of those clinical trials are sponsored by African entities, Lagos State Government in Nigeria and the University of Cape Town in South Africa. So there is an enormous gap here. And yet we have a lot of experience in Africa that could actually support the global response to the pandemic. We've dealt with many shocks like the Ebola epidemic and many others, and we've built certain knowledge bases. You look at the test opportunity that's come out of Senegal or the claims for a therapeutic cure in Madagascar. Why is it that these are not getting global attention and responses? Because we've not invested in the infrastructure that is needed to drive the knowledge that can create support for these and tests for these innovations that's coming out of the continent. So as I look at it and I look at what our response should be and how we are responding, I think there is an urgent need for us to recognize that going forward, Africa has to depend on its local institutions, its organizations to drive the response to the pandemic. And we have to invest in these institutions to be able to do this. For me, I think this is a critical learning opportunity for us as a continent.
Very good, thank you. And certainly that would help us point to greater resilience and the ability to respond. I would now like to address Honorable Charity Njilu. As the governor of a large rural and peri-urban county in Kenya, can you share with us the top 3 challenges you have faced on the subnational level in helping your community to address the social and economic impacts of the COVID-19 pandemic, and tell us about some of the steps you have taken and the initiatives that you have led as part of that response?
Thank you so much, Margot, and good morning, each one of you here. It is evening. Thank you for having me in this discussion. Here in Kenya, as the governor of Kitui, like many other areas in the African continent, COVID-19 hit us and found us extremely unprepared and unexpected of what happened to all of us. And for me to be able to cushion and help my own county, I was able, first of all, to look at what needed to be done. The first thing, like all other areas, was to continuously educate people on this pandemic, how they need to protect and prevent themselves, how they need to ensure that they are tested, which has become a huge challenge because we do not have the testing kits, we do not have the PPEs, we do not have adequate water, and therefore I said on our own, because we were not getting support from anybody, we needed to quickly come together, and I provided leadership for them to know that they need to protect themselves. I was able to bring together, mobilize the resources that we had here to provide at least tanks to the shopping areas, to tell people to keep social distances, to bring all people together, especially faith-based organizations here, so that they can help me in educating people on what they needed to do. Of course, our health systems are very fragile, and I had also to say, these health systems that we have is what we have got to make with what we have and what is happening. So at least we have been able to do that. And the other challenge, of course, is because we also have a poor rural community, and people cannot even afford the face masks. So I had quickly to turn our small county, Kitui County Textile Center, where we have been making garments, where I put it a year ago, just to help the young women and young men in this county to produce garments for sale so that they have some work to do. So instead of making garments for sale, I said, turn it around quickly and let us start making face masks and the PPEs. At the moment, fortunately, we have done quite well because we are not only supplying Kitui County, but we are supplying in the whole country. We are also supplying the region. And they are making not so many, but they are making about 50,000 masks in a day. We are using them ourselves, and we are also being able to support the country. That is what we have been able to do. The other gains that we have lost as a county because of the stigma. Here in Kitui, I had helped women to go and use our health facilities for their delivery services. We had come from 43% to 78%. These gains have been lost because people are now not going to our health facilities and they are delivering in their homes. I am going to start losing mothers again. This is something that we continue to talk to people about, we continue to help them, but the poverty levels are too high in my county. Women have been affected much more than anybody else because, again, markets are closed. And because markets are closed, women are not even doing what they always do. They have no food to eat, they have no water, their children are now at home with them, they are not going to school, but we are making do with what we have in the county. And we continue to educate them. On the youth front, I'll put them together, and the youth now is learning to produce construction materials. I have about 300 of them doing night shift and day shift so that when this is over, the post-COVID preparedness, I can put them straight into construction of roads and other programs that we have in the county. So that we are already doing here in the county.
Thank you very much. That's very insightful. And we're going to come in the second round to talk about some of the pathways that you're building for recovery. I do want now to turn to Rima Nanavati. Given your work with the self-employed workers in the informal sector, many of them are in the informal sector, can you share with us your perspectives and what you're seeing on the ground in terms of the economic and social impact of this current pandemic and some of the measures you think need to be taken in order to address them?
Thank you so much. It's really an honor to be talking to the distinguished panelists, and thank you, Margot. As you rightly said, I represent the women workers in the informal economy in India, and 93% of the workforce in our country is in the informal economy. These are the wheels of the pyramid. Normally, everybody says that they are at the bottom or the base of the bottom of the pyramid, but we call them as the wheels of the pyramid. It is the contribution of these informal sector workers that keep the economy alive and moving. Let me share in the words of one of our members. When I was talking to her just yesterday, and she said that even the last or the tiny morsel of food is getting snatched away. There are no livelihoods for us. The work has all vanished. There's no transportation. And on top of it, the climate shocks destroy our crops. I do not know how will I feed my family. I feel it is better to die than to live a life like this. Just because we are poor, don't we have self-respect? And these are not the words of just one woman, but this is the reality of millions of poor informal sector workers. I think social distancing, lockdown, these are all very alien concepts for a community which is very social. They believe in community living, they believe in community life, in coming together. And therefore, I think if I'm living in a very small hut or in a small room with a family of 7 or 9 or 11 members, how do I practice social distancing? If I have to go and work every day in the farms, if I'm a salt farm worker, if I'm a fisheries worker, or if I'm a forest worker, how do I practice quarantine or social distancing? And therefore, they all feel quite strangulated and suffocated. There are issues of anxiety, whether they'll find work or not, what will it be like in the future, how long is this going to continue, and therefore, they have past debt to repay, they need more money to continue with agriculture and farming. So there are all these issues, and on top of it, children are at home. So I think we have to work on different aspects. How do you keep the children engaged? We are the privileged ones, we can have virtual learning, but not the children of these workers who are living in the slums or in the villages. So how do you keep these children engaged in meaningful, productive work so that they are able to learn something? The second area that you have to work is that what kind of alternative livelihoods these households can really practice so that they feel that, you know, they're not just sitting idle and always surrounded by a lot of stress and anxiety. So we asked them to make paper bags. India wants to be a plastic-free nation. So how do you make paper bags? As the Governor Anjulu was saying, we asked the women to make masks. They make small snacks and then they are sold in the local areas, and that's how, you know, they start earning something so that they don't feel cash starved and pushed back into the vicious circle of poverty. But I must say that, you know, innovation is always a coping or a survival strategy for these informal sector workers. But I think COVID and post-COVID has pushed us to look at innovation plus. And what does this mean? So I think we have to look at localization. It's local production, local consumption. How do you connect the producer to the local customer, but in a decentralized manner so that it strengthens the local economy? And I think also our experience has shown that poor do not want charity. But all they need is to, you know, strengthen and scale up their tiny, fragile micro enterprises. And that's where we have to call upon the governments, the corporations, the multilaterals, the private sector to work on setting up a livelihood recovery fund so that these tiny and micro enterprises can survive and also scale up to generate employment opportunities post-COVID.
Thank you so much, Rima. In fact, you've led us very neatly into the discussion about resilience and pathways beyond response, but thinking in terms of recovery, because that's really going to be critical. And it will also contribute to the resilience of our communities and our countries, but globally, going forward, and to be better prepared for future shocks, whether they be disease or environmental events. And we know that as where we are right now, we have to be prepared, and there's the projection that we will see more of these things. Also, we're going to see a global recession. It's already well on the way, so we need to think about these things. I want to turn to Fernando again, because you've helped us to understand from your work on the social cohesion aspects, the range of issues, but you've had some very definitive policy prescriptions that you mentioned. Can you help us to see those prescriptions in the context of the pathways to recovery and how to position those families so that they're economically stronger coming out of this pandemic? Not that that's an easy task, but we've got to start somewhere.
Yeah, okay. As I mentioned before, Margot, while Latin America is quite varied, I'm going to focus on a number of policy prescriptions that I think are valid for most of the region with different emphasis. The first one is about public utilities. While some households, especially rural households in Latin America, have not yet been reached by modern public utilities, a highly urbanized region has moved ahead in this sense. So that's an asset we have and that we might lose, because in many cases, those public utilities are privately managed and publicly regulated. Yet many people might start losing their access to electricity, they might start losing their access to clean, drinkable water, etc., if we don't put in place a basic system where we're guaranteeing this, as we know families are going through a hard time. Secondly, while approximately between 30 to 40% of the population in Latin America is formalized, the working population, almost 60% is in formal sectors to different degrees of informality. Some have some protection, but most do not have. These people will most likely lose a big part of their livelihoods in terms of income and have no forms of social insurance to cope with this. We need to reach them through the systems of cash transfer that we have put together and through thinking out of the box other systems, through mobile phones, etc., that will reach them with cash. And we should do this more than what some countries in Latin America are doing, which is through a centralized mechanism distributing food in kind. Why? Partly because of what was mentioned before. We want to put cash into the informal urban sector communities, into the micro enterprises that still are producing foodstuff. We want money to circulate in these communities. So this is the second thing. And the third thing, which I think is very important and was mentioned here, and it's even more critical when we think about sub-Saharan Africa or countries like India and many countries of lower levels of development in Latin America, it's that we have to combine this. We have to think about these lockdown and confinement strategies from the global south and the limits and the hurt that it poses to people. One of those critical things has to do with school and children and schools. Closing schools implies in Europe and in the industrialized world a major problematic. It's even more problematic in the global south. If there's one area in the global south where the state has reached the population, that's the public system of education. Even if it's fragile in certain aspects, we have been there. To take that away completely, it's another thing that implies major problematic for this population. Of course, there is the epidemiological concerns. But again, we have to think about these three areas: public utilities, education, schooling, and cash transfers and basically livelihood support, sometimes food programs. These three things have to be in place. They are not. In the case of Latin America, for most countries, they are not unattainable with our fiscal capacities and with our credit lines. We can and should do it. There's a need for political will. For some countries in Latin America, Guatemala, Honduras, Bolivia, etc., this brings forth the other issue: multilateral cooperation and multilateral support. If we have to treat this as a global pandemic, the national solutions where there's no fiscal capacity have to be thought as a global problem, not as a national problem. So we need to put in place the necessary funds at the global level to support countries in the global south that are not able and will not be able with their own fiscal resources to provide these basic social protection.
Thank you very much. I want to turn to Professor Azain now. Alex, you clearly made a very clear statement about where you see some of the gaps, the need for action, particularly in building an infrastructure that will enable Sub-Saharan Africa as a continent to utilize its extensive resources as part of the response. I would posit that this needs to be factored into the recovery. What would be some three of the key things that you would like to see happen as part of that pathway to recovery in terms of global health?
Thank you, Margot. Let me start off by actually congratulating Governor Ngilo for the action that she's taken in her county to support the production of masks within that county that is now being used within the county, within the country, and being sold across the region. I think one of the biggest challenges we have in Africa is the fact that we are a continent that is dependent on others for almost everything we need. Production capacity, manufacturing capacity, even basic consultancies. We export our data and we import consultants to interpret that data for us. We export our natural resources and import the finished products and everything. And when you have a pandemic that is global, where there is scarcity in life-saving resources, the first line of action for many countries is to use what they have to support their local needs. And that's why, and once you've met your needs, you can then look at who has what you need that you can trade with. So I can supply what I have to you and buy what you have to us. On both counts, we lose in Africa because we are not producing anything. And in that instance, that's why you see huge shortages of test kits in various places. You think about ventilators, if it is needed for care, how many do we have in a typical country on the continent? So I will start off by saying that our recovery effort needs to look beyond the immediate term to a longer term approach where we invest in local institutions, in our manufacturing capacity, in local knowledge generation around the opportunities that we need to move Africa forward. I think we have to invest in these institutions. They are critical to development because at the end of the day, when we have pandemics like this, we are left on our own, as Governor Gilu mentioned. We are left on our own to manage it, and we have had to turn to our local institutions. But they face serious challenges. And to me, part of our recovery effort will be raising the question, how do we invest in our own? How do we support our hospitals so that when we are sick, we can actually go to them to get the care we need? How do we support our universities so they drive the research that is needed to create the knowledge base that can support our economy going forward? These are basic things that every country that has made progress have had to do, and we cannot get it otherwise. We cannot import development from outside into Africa. We have to organically grow it. And it starts with realizing what we have and investing in those resources. And I think our development partners and our governments and leaders would need to see this as a wake-up call, that we need these local investments in institutions, in research, in knowledge generation, in manufacturing capacity to weather not just this pandemic, but the many more that will be coming in future.
Thank you very much. That I think is very cogent argument, and it certainly is a call to action. And thank you for that. Governor Ngilu, you've already started in your initial remarks to identify some of the things you're doing to not only increase the resilience of your community, but also to build some pathways for recovery, economic and social recovery. Can you elaborate on some of the steps and tell us what are the three of the critical things that you feel need to be done?
Let me say, quite honestly, in African continent and in my county, I have everything that I need. I tell you, first, I have the people. Two, I have the knowledge because I have doctors in my hospitals, I have pharmacists, I have people who know what we need to do. So I think the problem that we got, the challenge for me, helped me understand that I needed to do something because I have nobody to call and to help me. And when I brought together my pharmacists, my doctors, and I said, we need to have sanitizers. Where do we get these? They told me, Governor, look at the component, what you need for sanitizers. You need ethanol, which you can buy. You need glycerol, which you can buy. And you need the containers. And I said, and will you make it? And they said, yes. And I very quickly set up a room and they made sanitizers for my people, which means I did not have to take money to go and buy because they're also very expensive. I also quickly had to go out and look for fairly cheap containers, tanks, and I put water and the delivery to people and the soap. And I also got women to start making soap locally, everything is local. So I truly think that our results that we'll eventually get will require our own solutions. We domesticate our own solutions. We'll not get solutions of our problems because when I started making garments here, everybody said, what is this you are doing? And everyone was bringing garments and uniforms from China. And I said, we don't have to get everything from outside here. Now I'm amazed by the number of things that I'm making right here in Kitui. And tomorrow I am having one of the great researchers from Kenya to come to my hospital, and they'll spend a whole day with us to show us how we can manufacture some of these things. We need the ingredients, you know, the active pharmaceutical ingredients. They'll show us how to mix them, and we'll use them and we'll sell them to other people. Therefore, we have got to look for homegrown solutions, quite honestly. And I want to say to ourselves that when something like this has happened, when everybody is now trying to recover, they will be recovering first themselves. They will not think about us. And our leadership in the African continent has got to come back and to only go to look for support and showing clearly the gaps that we have. You must do something. You show the results that you want to achieve. Then you can say, this is what I need to achieve this for my people. We've turned ourselves into not wanting to produce anything. We have, especially the women of Africa, the youth of Africa, have been forever lip serviced, people sympathizing with our situation. Surely African women do not need sympathy. We need action, and a sustainable action. And being told, these are the markets, build skills in us, and we'll be able to stand and rise to the occasion. So for us to prepare ourselves now, post-COVID, we need to prepare our people to know this has happened, and this is the support that I need. The market is here, and we'll be able to move forward. We also know that as the markets will eventually open, we'll have nothing to sell in these markets because we are not producing right now. The problems that we have will call for us not to think of what will come from outside, because I'm looking at the global problem that we have. And I know globally people will be thinking of how to take care of themselves. They will not be able to support us in any way. Even those who are manufacturing, I think when they open, they'll deal with their own people. So I want to ask Professor Ezel that we now got to think about ourselves, because if we do not do so, Professor, we will be left high and dry by other communities. And we must continue now talking to ourselves and see how we can help ourselves.
Absolutely.
Thank you very much for that. That in itself is a call to action. But I think you've also highlighted the fact that often we see policies being made top-down, recommendations being made globally that filter onto countries, and country leaderships passing down recommendations for action. What I think I hear from you is the fact that communities understand their circumstances and therefore have to, at the end of the day, determine what works best for them. So thank you very much for sharing that, because this is what I call inclusive policymaking at its best. I'm going to turn now to Rima.
Thank you.
As the final, you have the last word, to tell us what are some of the things, and you identified quite a few, but in terms of particularly for the informal economy, and the lessons of India apply across the world, applies in sub-Saharan Africa as well. What are some of the 3 key things that you think, and see them as opportunities probably, in building a pathway for recovery, looking beyond this, but assuring resilience of the communities and the people in the informal sector?
Thank you, and I really appreciate what Governor Angelo just said, which again re-emphasizes localization. And what she's emphasizing is local production, local consumption, local distribution. And I think that's what one needs to do in countries of the global south, that, you know, we need to strengthen the local economy. How do you build local supply chains rather than being dependent only on global supply chains? So I think one important aspect is that You need to strengthen agriculture and farming. Even in the times of COVID, we are experiencing that there are vegetable growers and there are vegetable vendors. So how do you connect the vegetable growers with the vendors? And you directly supply to the customer. So a vendor now becomes a retailer who is delivering to every home. And we could put that enterprise in place in less than 15 days' time. So today we have 100 vegetable growers and there are 100 vegetable vendors who now have e-rickshaws, and they are going from homes to homes. We take orders in advance and then we deliver it at home. So now I have a dignified livelihood as well. Likewise, everybody was talking about online platforms and how this can happen, but it already happened. People are now buying online. People want less and less of human touch that is going to be there. So how do we upskill, reskill our workers and our producers so that they also are able to be into the mainstream? I think along with in the sector of health, the government's focus is only on health, Medicare, health infrastructure. But I think along with preventive measures like vaccines, we also need to focus on better nutrition, upgrading the skills, good income, life insurance. So how do you build a different society which is not susceptible to a disease and devastation? But how do you build resilient communities? So if a member of a family is sick, the whole family also gets infected and is sick, and then the community gets in. So there's so much of interconnectedness, and that interconnectedness needs to be recognized. So along with healthcare, how do you work on better nutrition, on skills, on good income, on insurance, and the whole holistic integrated approach? So I think, and then strengthening the tiny and the micro enterprises.
Thank you very much. I want to thank the panel for your very thoughtful and insightful thinking and articulation of ideas that I think are very important as we go forward. I'd like to also draw attention to the fact that we have recorded 2 keynotes that speak to some of these issues. We have a keynote by Dr. Stephen Karingi, who's the Director of Regional Integration at the United Nations Economic Commission for Africa. And they've produced a document that outlines a COVID response agenda for sub-Saharan Africa, and he's used that as a basis for his comments. And also we have another keynote delivered by Sandro Galea, Dr. Sandro Galea, who's the Dean at the School of Public Health at Boston University. And he has devoted his comments to the whole idea of health as a global public good and developed a rationale for why this global pandemic actually requires that we work together, whether you're in the north, south, east, or west, recognizing that if the health of a country that is not your own is affected, your country ultimately will be affected. I heard on a WHO session a couple of weeks ago, someone saying that a virus anywhere is a virus everywhere. So that should be really a very important motivation for us to look at it from this perspective. And I look forward to continuing this discussion. I thank you for making these inputs as part of the Think 20 process through the Global Solutions Summit. And I thank you again for your contribution.